Meanwhile, the Health Minister Joe Phaahla has announced that his department will be working with provinces to test a model of providing transport to move people from high-density population areas to urban areas. The minister says walk-ins are being accepted and that registrations are also being administered at vaccination sites. Pregnant women in the age group of 18 to 34 can also receive the jab. To talk a little bit more about this is Dr. Sibongiseni Dhlomo, the newly appointed Deputy Health Minister. A very good evening to you, Dr. Dhlomo, and thank you so much for speaking to us. Let me just first with this particular aspect, is there a recommendation that alert level 3 go on as the third wave seems to persist?
Good evening, and good evening to our viewers. Yes, while we notice that in Gauteng we are probably over the third wave, we are not yet out of the woods in the Western Cape, KwaZulu-Natal, and obviously in the Northern Cape. So we are completely not there yet to recommend that we move levels out of where we are. We still are at the height of these third waves in those three provinces. So I think what we have still really is necessary to keep.
Mm-hmm. And just in terms of hospital admissions, by how much over the past 7 days has this increased or decreased, and is this a general national trend?
That's exciting, Tsepiso, for that. We have decreased the hospital admissions by just 4.5%. We hope to see an increasing trend. That is also giving us hope because, of course, you know, once you see an improvement in Gauteng, which is a very populous province, and you see less and less admissions, you're likely to then see less and less admissions in the whole country. So there has been a decrease in this week by 4.5% of hospital admissions.
But Dr. Dhlomo, please clarify this, because I want to look at the Western Cape. It is now the epicenter of COVID-19 in the country. And we know that there has been reports saying that there is an increase in high care facilities. Is this congruent with what you're saying to us now?
Yes, no. We do have challenges of the Western Cape in terms of the numbers, but we have not been over. The minister currently is, in fact, is traveling in the Western Cape to actually observe and monitor. But the report that we did have last week from the MEC was not indicative that they are overwhelmed in terms of the beds now. But we are actually monitoring the situation almost on a weekly and daily basis.
So you have talked about streamlining workplace vaccinations and bringing the government closer to its target of vaccinating 70% of the adult population as in herd immunity. How are you going to speed that up?
We're following what the minister is actually advising us to do, to say, let's take the vaccines to where people are. So people are in the malls, let's open up vaccination sites in the malls. Let's meet our people coming in or going to work in the taxi ranks. Let us also see where we cannot have drive-throughs and just in a park and drive through there and then get a jab and then wait 10 minutes later, we can then release you. But as you, in your opening comments mentioned, there's a pilot program starting on Tuesday next week in Gauteng, targeting mainly Tshwane and Johannesburg. In KwaZulu-Natal, we'll be targeting Durban, and in Eastern Cape, targeting Gqeberha, where we'll be moving our elderly senior citizens, Zwide, Motherwell and New Brighton, to a bigger, massive vaccination sites. We will be starting this next week on Tuesday, hopefully, and see how it goes by month end, where we are really encouraging all our elderly people to make use of that free transport that the department is going to provide. Of course, this we have worked out with the transport leaders in all those various areas. In Gauteng, it will be targeting areas like Ivory Park, Diepsloot, and Alexander, taking people to Gallagher Estate for massive vaccination.
Dr. Dhlomo, I'd like to talk facts and figures. The under 35 age group, we believe, includes about some 700,000 students who are now eligible for vaccinations. But just how bad is vaccine hesitancy? I mean, we have some of them writing into us now. What are the accurate figures? Is it really mainly men who fall under this age group, or is that generally?
Yeah, no, but we opened up vaccinations for the 18-year-olds to 34-year-olds today. And when the minister was having a media brief this morning, we had about 184,000 already were registered, and we hope the numbers have increased. We also like to encourage the young ones because they are out there with their smartphones, iPhone. Every now and then they use their phones, then they can register. But not only should they register and wait, they can register as they walk into any vaccination site because we won't turn people away. No, the issue of the piece of the men versus women is just general in the world, and our country is one of those. People who have a health-seeking behavior are usually women. People just go to a clinic to check if everything is okay. Can I check this and that? So men are reluctant to do that. So we are actually pleading with men to also show their visibility because we don't delay them. Because it's no use. You know this episode. Sometimes in the past, men used to say, "No, my wife has tested for HIV, therefore I know my status." It can't be like that. It can't work like that. So we would want individually members of the society to come forward and be vaccinated because we do have a very positive story to tell for those who have been vaccinated.
But Deputy Minister, how are you going to address this misinformation and disinformation flow? Because the concerns about things such as side effects and that the vaccine will be ineffective are some of the most common reported explanations for vaccine hesitancy. I know this is across race divide, education divide, in some cases also even a gender divide. How are you going to address this?
I was saying, so all of us sitting here in the country, at least I know one or two nurses who have been vaccinated. Let's ask their experiences in the community where we live. I know one or two police people who have been vaccinated, one or two teachers who have been vaccinated, and here their experiences. The side effects are there, but they're very mild. They are very mild. There's a small itch where you have been vaccinated, maybe wake up the next day with a bit of dizziness and the nausea, and it goes away. These massive, very fake news of infertility problems are not there. Scientists have not indicated that. So we'd like our people to really heed to this real request because the benefits of vaccinations are much more than not being vaccinated. For every 100 people who get admitted into a hospital on a COVID-related infection, 99% of those people have not been vaccinated. Only one person gets to be admitted having been vaccinated before, of course, because they will still get mild and moderate infection, but massively, if you are vaccinated, you reduce hospital admissions, ICU, and deaths. We really are pleading. Probably now that we are registering the 18-year-olds and above, those sporting celebrities, the young stars who are there, will also champion this program and come and tell their colleagues, there are people that know there's nothing like this that is happening.
All right. Thank you so much for speaking to us. Dr. Sibongiseni Dhlomo is the Deputy Health Minister, speaking to us there about the innovative ways they are going about to encourage people to vaccinate, especially in terms of access.